Healthcare costs are rising and more of the financial responsibility is shifting directly to patients. But here's the challenge. Even when patients want to pay, many healthcare providers still struggle with delayed or missing payments. And in most cases, it's not because patients refuse to pay. It's because communication breaks down somewhere in the billing process. That's where a well-written medical collection letter becomes essential. Today we're breaking down how medical collection letters work, why they matter, and how to write them in a way that actually improves payment collections. Let's start with the real reason payments get delayed. Most patients don't intentionally ignore medical bills. Instead, delays usually happen because of financial constraints, confusions about insurance coverage, unclear billing statements, or unexpected out-of-pocket costs like deductibles or copays. In many cases, patients receive a bill but don't fully understand what insurance covered or what they still owe. And that confusion leads to one outcome: delay. Now, here's something important. A medical collection letter is not the same as a letter of medical necessity. A letter of medical necessity is sent to insurance companies to justify treatment. A medical collection letter, on the other hand, is focused on recovering an outstanding balance directly from the patient. If that distinction isn't clear, patients can become even more confused and accounts can quickly become overdue. A strong medical collection letter does three things. It informs, clarifies, and guides action. But just as important, it does it in a way that feels supportive, not aggressive. Instead of pushing patients away, the goal is to encourage them to take the next step in resolving their balance. And ideally, this happens before accounts become delinquent or require collection agencies. The best performing letters act as a friendly reminder, not a final warning. So what actually makes a medical collection letter effective? It comes down to clarity. Every letter should clearly include the total amount owed, the current balance due, due dates or payments, payment deadline, payment timelines, and the status of the account. But it doesn't stop there. You also want to include payment options like flexible payment plans, installment options, or financial assistance programs if available. Because many patients aren't avoiding payment, they simply can't pay everything at once. And here's a critical point. Your letter should also eliminate confusion. Patients should never walk away unsure if they still owe money or if their balance has already been resolved. Clear communication prevents duplicate payments, misunderstandings, and frustrations. Now, let's talk about something most providers underestimate: tone. The tone of your medical collection letter can directly impact whether a patient responds or ignores it completely. A strong tone is empathetic, supportive, clear, and respectful, not demanding. Instead of sounding like a final notice, the letter should feel like a collaborative reminder. Simple phrases like "please contact us with any questions," "we're here to help," or "let us know if you need payment options" go a long way in improving response rates. Even when accounts are overdue, a respectful tone keeps communication open instead of shutting it down. Timing is another key factor. Most effective collection processes start with a reminder within 30 days of the original billing statement. From there, follow-ups may become more direct if there's no response, but consistency matters more than intensity. On top of that, communication methods also play a role. Some patients respond better to mailed letters, while others prefer email or text reminders. No matter the channel, everything must remain HIPAA compliant and protect patient data. Healthcare providers also face common challenges in medical collections. Patients may misunderstand insurance coverage, experience financial hardship, feel overwhelmed, or simply ignore communication that is unclear or too complex. And again, most of these issues come back to one thing: clarity. When patients don't understand what they owe, they delay action. When communication is clear, payments improve. At the end of the day, a medical collection letter is not just about collecting money. It's about communication. When done correctly, medical collection letters improve payment rates, reduce outstanding balances, strengthen patient experiences, and create a smoother financial experience. If you'd like to learn more about improving your medical billing and revenue cycle processes, please reach out to Etactics. And since you made this far into the video, you might as well like it, share it, and comment down below.